Hi, thank you BW for allowing me to show the audience the beforehand transplant. We're gonna do month-to-month progress because you know that will help the audience and the viewer to see what's it like starting before surgery, the 1 month later or 2 months later, to understand the progress, and that's very helpful to get your mind at ease what's to expect for the recovery look like. Ben is kind enough to to do this, and he will do it no pay, because he worked nearby and he out of his time, and he will come by here once a month to allow us to show the progress. I'm excited for him because he's gonna look great. If you can tilt down here, see, if I look down a little bit, Ben, you can see how significant thinness he has here. Okay, and so I'll go to do at least 2,500 here. He want to limit to around 2,500, so we're gonna do that. And then so for sure, definitely build the wall of hair here. Anything extra, then we'll scatter toward the transom as well. He has a widow's peak already, so we're not changing who he is and keep the widow's peak. And then we'll build the hairline according to his facial structure, a third and a third. And the line we have is just a guide. But when we really do it, there's a lot of feathering to really give you a natural look. Again, we do the front row, we will do single hair roots and feather in a random zigzag pattern. But behind it, we tend for the best density, we understand that it's more natural to do random in the back, transplant hair, thicker hair and random in the back. However, it won't be as dense as transplant in rows, or in linear column or in rows, because when you do that, you dense pack it more, you can put more in and you produce better density. And by doing thicker linear rows in the back, when the hair grow out, you don't see it. It won't affect the naturalness of the hairline, because the goal of row dense transplant in the back is for density. But the front, we will hide it by doing a lot of feathering of single hair graft in the front with a random pattern, a zigzag pattern. That will determine the naturalness of the hairline and the shape of the hairline. But the transplant row or linear in the back are designed for density only, but it won't alter the shape of the hairline or the naturalness of the hairline. I'm excited for him. You're gonna see when he grow his hair out, in a year time he will look different. Okay, thank you. Thank you, BR, for allowing me to show to, the audience what it will look like. But this is the first day right before FUE hair transplant surgery of 2,500.